All right, good morning. I'm gonna do a tracheostomy care. So the first thing I always do is check the patient's chart. So the first thing I'm gonna look for to see their trach. It may state that what kind of trach it is, so that way I know what kind of necessary supplies that I'll need, especially if if I need to replace the inner cannula. That way I can take that along with me, the extra supplies that I need. So when I'm ready and I have all my supplies ready to go, I can go ahead and head to the patient's room. Then I will knock on the patient's door. And after I knock on the patient's door, I'm going to introduce myself. So, hi, my name is Amy. I'm a respiratory care student with the respiratory care department. And I'm going to clean out your trach and everything. That way we keep it sanitary, so that way you don't cause any infections and it stays nice and clean there. So when I'm ready, I would always check my patient's ID band before I do anything. I wash my hands, make sure my hands are clean. Then I would apply the appropriate PPE. So I'd wear gloves. I'd make sure I have my gloves. I can wear a face mask, just that way I don't have any airborne anything, nothing going towards like that opening, because we don't want to cause any infections for them or anything like that, or anything that may come up from the secretions that may come splashing up. So we always check, so we always verify what kind of trach they have. We kind of look it over, make sure we have our supplies. So after I have washed my hands and everything, and always check the patient's vital signs in the beginning. Also take the lungs, hear anything, see if you hear any crackles from any secretions, anything like that. So I'd apply my gloves, appropriate PPE, always have that ready. And so then I would prepare the trach kit. So we don't have a trach kit, but we would have normal saline and we would have peroxide to clean out the trach and everything, and the inner cannula. So if it has one that has to be placed back in or anything, we would take our peroxide and we would clean inside the inner cannula, and we would always make sure we clean it out after with the peroxide with normal saline, make sure it's nice and clean before we place it or anything like that inside the trach. And so when you have a trach here, so always you want to remove the old gauze, the 4x4 gauze that's underneath it, very carefully, not to move anything. Make sure you hold it nice and steady when you go to remove it. Then you would dispose of that. And then always when you do it, you want to take your mixture solution with your peroxide and saline. You always want to clean. So I pretend I have a stoma here. So I go clean, very gently, clean underneath and around, just to make sure I get any of that excess, anything like that when I do that. And always when you do a trach care cleaning, you always want to make sure you suction out any excessive secretions that they may have in there. That way it's nice and clean and you're helping them clear that out. And so you would always clean that up. And then if you need to, you can replace, if they need to replace the bands or anything around them, then you can replace that. So you can have somebody help you. If you need somebody to help you hold, just so that way it stays in place, you can have that. And you want to make sure it doesn't move. And then when you're done, you would make sure you have the band on properly. Always make sure you can fit in 2 fingers underneath the band, just that way it's not too tight and it won't cause any sores on the patient's neck or anything. So when you're ready, if you have a disposable inner cannula, so you'd always remove that inner cannula that can be dispose of it, and replace it with a new one. Always make sure it's fitted in properly, make sure it's on correctly, and make sure everything's sanitized around. So when you're done with everything, with the cleaning and sanitizing everything, and you would always replace the gauze after you cleaned around the stoma. Put a 4x4 gauze underneath, and it usually has a little slit down the middle just to go properly right around that tubing of the trach. And so when you're done, you have everything placed, everything's back to where it needs to be. Then you would also listen. You'd also check to make sure it's in proper place. Also, like, listen to the sounds, make sure nothing sounds abnormally after you do it, and then you would always dispose of anything that you have used or anything, like we would place a drape over them if we need to, then we dispose of that, anything like that. Always remove like your PPE, check their vital signs, make sure they're still doing okay before you leave the patient's room. Then after we remove the PPE and everything, wash our hands, and then I would go and chart on the patient's chart that I did a Trach Care with them, and that way the other nurses and any other staff know that we did a Trach Care with them.